Then it has a concave blade, it has a groove, and the shaft. So some of the indications for the use of a SIM speculum, it can be used to examine the cervix and vagina for discharge, for cervicitis, polyps, prolapse, malformations. It can also be used to carry out biopsies for D&C once performing HSG, hysteroscopy, vaginal hysterectomies. And then, of course, you can use it to examine for tears. You can also use it to pack the uterine cavity. So the reason why it's called SIM speculum is because you use it in the SIMS position, which is the left, which is asking the patient to lie on the left side and bringing the knees to her chest. That is the SIMS position. So of course, while using either couscous or SIMS speculum, you have to lubricate with jelly. Then you part the labia minora, and then the blade, you insert the blade with its transverse axis. Then you rotate it. So the main advantage of this SIM speculum over the couscous speculum is it gives you more exposure of the vaginal walls. It doesn't cover the anterior or the posterior vaginal wall. So it is easier in examining the anterior, and it is easier to examine the anterior and posterior vaginal walls. Then it is also possible to slide the speculum around the vaginal wall to enable better visualization, since it is not self-returning, so you can maneuver it. Then, of course, the groove part of the instrument allows discharges and secretions to flow freely, so there won't be any chance of your vision being blocked by the secretions or blood that you might encounter. Then this next instrument is Doyne's retractor, which has a broad blade and a shaft. Its main use is to actively separate edges of a surgical incision or wound. And then it can also be used during cesarean section to retract the bladder away from the incision site of the uterus. This is its major importance in ONG, actually. So during cesarean section, before you make the uterine incision, you retract the bladder away, so that while you are cutting the uterus, you don't cut along with the bladder. Then this next instrument is what is called Green Armitage. And if you look at it, it has a triangular tip, which has these transverse serrations, which has these transverse lines. So it is used to hold edges of lower segments of the uterus after delivery of the fetus during cesarean section. Its main advantage is it's atraumatic, so it won't cause further bleeding, and then it is hemostatic. It helps you in securing any bleeding vessels that are in that lower segment. It can also be used in a place of sponge holding forceps for dressing cervical tears. So that is about Green Armitage. And then so this instrument and the next one are a bit tricky. So this one is tenaculum, and then this next one is valcellum. They both can be used for similar purposes, but then how you differentiate them is tenaculum has a single tooth. So the tooths are single actually, but if you look at valcellum, it has multiple teeth, sometimes double. So the tenaculum, like I said, has a single tooth, then valcellum has double. The uses they are mainly used to hold the lip of the cervix during either MVA or insertion of IUCD. Then This is a Karman syringe or Karman cannula. It is mostly plastic, soft, flexible cannula. And then its flexibility actually helps in reducing risk of perforating uterus during vacuum aspiration. So indications for it has several parts as well. As you can see, it has a cap. Actually, you will need to learn how to assemble it for you to be able to use it because it has different parts. It's just like a modified, a more complicated, it's like a complicated syringe. It works just like a syringe, but it's kind of more complicated than a syringe. So its uses include it is used for surgical abortion. It can also be used to complete an incomplete abortion. It can also be used in taking endometrial biopsies. And then you can as well use it for suction and evacuation of molar gestation. Then this is an episiotomy scissors. As you can see, there are different types, different angles, different shapes, but they are all episiotomy scissors. These scissors, they are angled and they have a smooth and a blunt tip. And then they are of different length, of course. So you have one end which is sharp and then the other end which is blunt. So the use is for making episiotomies, which is cutting the perineal skin and tissue to facilitate easier passage of the fetal head during delivery. So how you give an episiotomy is basically you have to give it's given under local anesthesia after the head has crowned. And then you say the head has crowned when the head no more recedes back into the pelvis. So the head becomes fixed, it doesn't go back into the pelvis. That is when you say the head has crowned. So you do it at that point, you give a local anesthetic, then you insert the sharp blade of the instrument into the vagina such that the blunt end is facing the baby's head so that you don't injure the baby. So you use 2 fingers and then you either give a mediolateral or a medial episiotomy. Of course, you are cutting through 3 layers. So when suturing, you suture 3 layers as well: the vagina, the perineal muscle, and the skin. Complications that could occur include it could extend to cause a perineal tear if not done properly, and then it can, when given a midline episiotomy, it can extend into the anal sphincters and cause incontinence. This is a Heger's dilator. So this one, it comes as a set of different sizes from the smallest to the biggest. They are metallic rods with increasing diameter. They are round, slightly curved, and then they have a canal tip. So some have the tips at both ends, while others have only have one end flattened for easy handling. So the dilators, they are numbered according to the diameter. So if it says it's number 8, that means the diameter is 8 millimeters. Number 9, that means the diameter is 9 millimeters, and so on. So indications for its use they are used for dilation of the cervix in procedures. For example, during D and C, if the cervix is not opened, you have to use a Heger's dilator to open the cervix first and then perform the D&C. And now this one is a uterine sound. It's also a metallic rod which has a curved distal end. This part, which is at an angle of about 60 degrees. Then this tip is blunt. The indications for use of a uterine sound include determining the length of the uterus. You want to check the length of the uterus before you start procedures like IUCD insertion, HSG, or manual vacuum aspiration. So you want to check the size. For example, in MVA, you want to estimate the gestational age such that as you are doing the MVA, that length will be reducing, and then you know where to stop so that you don't perforate the uterus. Of course, complications that could occur include cervical trauma, which can result in cervical incompetence. You can cause uterine perforation. There could be bleeding as well due to the cervical lacerations that can occur. Then this one is an iris spatula and cyto brush. The wooden one, this is the iris spatula, and this other one is the cyto brush. So the spatula is a wooden spatula with a U-shaped openings on one side and a flat surface on the other side. This is the U-shaped, and then this one is kind of flat. So the indications for its use include you can use it for vaginal sample collection. For vaginal sample collection, that is the broad end. Then the narrower end, you can use it for cervical sample collection. Of course, the cyto brush is also used for taking samples, mostly cervical smear, during pap smear. So of course, you have to be able to visualize the cervix before you can use either of them. So you have to use you have to visualize the cervical os using a speculum, mostly couscous speculum. Then you rotate this cyto brush 360 degrees to obtain the sample for pap smear examination. Then you quickly transfer them into the sample container. Sometimes you can just drop this tip into the bottle. And then this is a delivery forceps, which there are several types. There could be outlet forceps, mid forceps. So the outlet forceps, they are used when you can see the scalp, when the scalp is visible at the vulva without separating the labia. Then the mid forceps, the head is engaged, but the leading part is usually above in like +2 station. So there are different types under each category, which you can look through, but then mostly they will just say it's a delivery forceps. So an example of an outlet forceps is the Wrigley's forceps. Then the outlet or low forceps is the Simpson or Elliott forceps. Then for mid forceps and rotation, you can an example is the Keyland forceps. So these are the parts of the forceps. They can have the blade, the curves, the shanks. Actually, the parts of the forceps, no one will actually ask about that. So like I said, it's going to be brief. This is it. Thank you, everyone. So if you have any question, you can unmute yourself and ask.
Sir, I have a question. Just one question about the Keyland's forceps. or the forceps in general. Is it important to know like the other types? Like we have the Killans and the Wrigleys and I think like four other ones, or just the Killan is enough?
Actually, there's no harm in you knowing the picture because sometimes you never know what they can ask. So get familiar with the picture. There are those the ones I mentioned are the common ones that you will come across. So if
Okay.
you can be able to differentiate them, it will be fine.
Okay. Well, thank you.
Right, it seems you guys don't have questions. All right, if you don't have questions, I think we can end it here. It was going to be a very short session, actually. So thank you very much.